Transcultural People Network.
Today we're talking about
The Polish culture.
Today on the field we have Emily.
Today I'm here with Javier, who is a chaplain. So I'm going to interview him about the Polish culture. So what are some religious beliefs of the Polish culture?
Well, most Polish people identify as Roman Catholic, but if you actually dig a little deeper and you look into the religious beliefs and the status of the churches, they're mostly closed, and people's beliefs tend to fall along the lines of secular humanism. So this would fall under naturalism, where there's a strong belief in evolution and in an old earth and in a really no God, and the belief that humans are the source of supreme good. Morality then becomes kind of relative. Whereas the Bible says that there is one God who created everything. The earth is roughly 6,000 years old, and there's no evolution. And that morality and truth comes from the Bible, which is the inspired word of God. So that's basically what they believe.
So how does that come into play then when you're kind of interacting with someone of the Polish culture, the conflicts kind of between their beliefs and then a biblical worldview?
Yeah, so as a chaplain, you just got to be careful not, and realize that many of them, will not have the same beliefs, But I've yet to see somebody who refuses prayer, the offer of prayer, even if they don't believe in anything. It's just kind of, people tend to accept prayer, I've noticed when I interact with Polish patients. So, you just be mindful, and if they ask you, if they refuse spiritual care, then you just respect that and you move on.
And I'm back with Emily, an anthropologist, who's going to be telling us about the Polish people. Emily, how do the Polish approach healthcare?
So typically, they view the U.S. healthcare system as complex, confusing, often overpriced. So they typically try to avoid it as much as possible. So it's really common, though, for Polish to smoke, drink, and engage in limited exercise. So those are some things we really have to look out for them.
Sure.
They practice stoicism, so they don't like to talk about their pain or weakness. They just like to keep it to themselves and appear strong. So they don't like to use over-the-counter medicines, take vitamins, and they refuse to even take time off work to go see the doctor. Also, it's common belief for them that if you do talk about your pain, it actually decreases your family status. Your family status looks weak. So they typically only go to the doctor if it's actually influencing their daily life. If they can't perform their job, if they can't even get out of bed, that's the time that they'll go see the doctor. But most of the time they'll try to treat it at home. So they often have inadequate pain management, and they deny or minimize their pain frequently. So even when they do go to the doctor, if they say rate your scale on a 1 to 10, they frequently make it lower, even though they are experiencing a large amount of pain. And then in terms of blood transfusions and organ donation, typically they don't like to use extraordinary measures to keep people alive, but it actually just depends on the family. They'll consult the family together and decide if that's something they want to do. So it just depends. It's not just they always don't believe in blood transfusions. You do have to ask.
Okay. Are there common foods that they have in their diet?
Yes, they often consume chicken, beef, and pork. A lot of their foods are high in fat, so they consume like pork knuckles and organ meats. And then their diet is made up of a lot of carbohydrates, fats, sodium, and sugars. And alcohol use is very common within their culture. They do it in social gatherings frequently, and smoking as well.
Okay. Are there any ethnic foods that they eat?
Yes, they eat. They frequently eat sauerkraut, stuffed cabbage, coffee cakes, and dumplings. So those are very frequent in their culture.
Sure. With that and everything. And how do women approach the healthcare?
So women are actually more compliant than men. They strictly follow physicians' orders, especially when they're pregnant, because they want to ensure a healthy pregnancy. But they do often go overlooked because they consider it their role to care for their family. And so they're focusing on the care of their husband, they're focusing on the care of their son or their daughter, and they often just ignore their own problems. So that's a problem for them. And they're often very modest and don't want to disrobe or reveal their health with like a male physician. So typically you need to have a female to female.
Okay. And what are common death rituals that they practice?
So often, again, they're stoic as far as death. They accept it. They don't talk about it. They don't cry. It often goes even unnoticed. Family and friends do often remain with the person up until the very end, though. They're very hospitable. Like, someone passes, family comes and cares for the children. They take on household chores. They bring food, things like that. They do want the body to be buried within 24 hours, and then they follow the funeral with a wake for 1 to 3 days, and that is then followed by a mass and then a religious burial.
So what is their religion? Do they have anything that they most commonly practice?
Yes, their religion, they are Catholic, majority of them. So they include the Catholic Church into their daily life. They're required to attend Mass on Sundays, and then Christmas or Easter are the two most important holidays for them. So they frequently have special foods and rituals that they perform on those holidays.
Sure. So they value family.
Yes.
What are common folk practices that they tend to engage in?
So frequently, like I said, they do like to try to treat themselves as much as possible by taking folk medicine or herbal remedies. So they try to cure illnesses, oftentimes like with honey and tea and spirits to sweat out a cold. Then oftentimes they also use rubbing compounds for aches, pains, back pain, muscle, inflammation and irritation. And then a weird one that I just recently learned about is they ingest gunpowder to actually make themselves throw up when they have stomach pain.
Oh.
So they try to get rid of the stomach pain by throwing up what is ever is in their stomach, making them sick. And then they treat boils frequently by soaking bread, a loaf of bread in milk, and then putting it on the boil to make draw out the core of the boil. And then for poor circulation, they often take a heated alcoholic swab shot glass, put it on the back, and that helps. They believe it helps promote circulation and helps with swollen areas on the skin.
So is it similar to cupping that we have out in the U.S.?
Yeah, it's similar to that. They actually call it bonky, but it is the same concept.
Okay, very cool. And how do they view healthcare providers?
Typically, it depends on how their treatment plan goes. If they get better fast, they believe that the healthcare provider was smart and they got the treatment they needed and they're happy. But if the treatment plan is prolonged, they view it as negative, like they didn't know what they were doing. So early discharges and they didn't get a bunch of treatment, they view as disrespect, that they didn't even get care. And then if they don't get treated as fast as they would like, they actually seek a second opinion, go see a different physician. Okay. So, but more educated Polish are actually more willing to cooperate, and they're more willing to understand and listen and follow their treatment regimens. So you just have to figure out on an individual basis what they need.
Sure. Thank you.
Okay, so here we have Dr. Anna, and I'm going to be asking her a few questions. So Dr. Anna, how is healthcare financed, supervised, and controlled in Poland?
Well, we have what's called the Ministry of Health and the National Health Fund and local governments within the territories that take care of the health for the people within their territories. So they try to raise awareness and prevent illnesses as best as they can. The ministry will provide any financial aid that they can. However, with the budgets, they actually have a hard time with it, and a lot of hospitals are heavily in debt because of it.
I see. And where does a patient go for treatment?
Our patients go to a place called the basic healthcare units where they will see a physician if they need to be seen. If the physician feels that they cannot give them proper treatment or that it's outside of their scope of practice, then they will give a referral similar to those people in the U.S. where they can send them to other specialty doctors who can focus in on whatever is causing their disease. However, due to the economy and things like that, and due to patients, depending on their status, social status, we try to limit referrals as much as we can, and the primary doctor does everything that they can before they send them on. Some patients appreciate that because they feel like they can have treatment followed very closely with one person, and others, if they don't think that they're getting treatment quick enough, will ask specifically to go ahead and have a referral. So their family, they'll turn to the men in their family and ask them to help give them more money so that they can afford other doctors.
Oh, I see. Okay, and what are the major causes of death in Poland?
Many people in Poland will die from cardiovascular disease. a lot of it is attributed to their health and their diet. They die from cancer. Lung cancer is prominent because a lot of people smoke. We have respiratory disease problems. We see a lot of patients that have digestive tract problems. They have high salt foods. They eat very greasy, fatty foods. And so it can mess up their digestive tract. And then what we're finding is that patients don't want to be super active in their community, and so things just sit in their stomach and they have problems with it.
I see. And are there any dominant illnesses in children?
Yes, children actually, most commonly, by the time they're 13 to 14 years of age, 10% of them will have been diagnosed with asthma. It's important that parents understand that those that have been diagnosed with asthma, they need to stay away from smoke. So secondhand smoke is it's a very real thing, and our population needs to be educated about that. A lot of the adults, they want to smoke, but they need to make sure that they do it in an area not near the children, because that can exacerbate their asthma and things like that. And children also struggle with conjunctivitis, allergic conjunctivitis.
I see.
Yeah.
And how does folk medicine come into play with patient care?
Those people that have lower income statuses, they feel that they cannot afford higher medical treatment. So oftentimes they will first turn to the mother or the female role model in their home, and they will ask them how they feel about the disease. Women are valued and respected for their knowledge. So if the mother doesn't, if they believe that they have home remedies that they can try, then they will start out with that before they ever go to see a doctor. So some people believe in mystical, magical acts, and they believe that illnesses are caused by spells, charms, and magic, and that the only way to get rid of them is through holy relics, amulets, and talisman. They're very convinced, those that really follow that are very convinced that revelation, inspiration, and clairvoyancy is the easiest way to make a diagnosis, and that casting the spells, charms, and things like that would help remove it as quickly as possible. So for those people that focus in on the folk medicine, it's almost as if physicians won't be able to help them because the physician didn't cause the disease. And so they really are strict in the supernatural powers and trying to take care of things from home, and they view illness as very bad, and they do not like to portray their pain. They don't like to, they see it as weakness. And so by the time we actually see them, most times they use some form of folk medicine to try to get rid of it. It's very hard for them. If they're going to come to see us doctors, they have to take time off from work, which is financial loss to the families. And so we have to, they take that into consideration, and so they try everything they can to not have to come to the doctor.
Very interesting. Thank you,
Yeah.
Dr. Anna, for your time.
Thank you.
Next up, we have Brittany interviewing Nurse Susanna.
So, Nurse Susanna, is there a certain way healthcare providers should introduce themselves when they see a patient?
Yes, very important that when you are talking to elders, especially, that you introduce by your last name. And also, if they don't speak English, it's okay to use a family member who's bilingual or an interpreter. But when it comes to assessments, you will want to primarily have an interpreter.
Very good. What are some things nurses should keep in mind when they're caring for a Polish patient?
So Poles are very strong people who also have a very strong work ethic. So they really value independence and don't want to be perceived as weak. Therefore, sickness is often equated with weakness, unfortunately, and this may prevent them from seeking medical help, especially when it comes to pain. So to help them, we may have to use a visual pain scale, which is that scale that has all the happy or unhappy faces on it, right, when we're doing a pain level of 1 to 10. We also want to teach distraction techniques, such as maybe listening to music or calming images, and we also want to educate the importance of prescribed pain medications. And also you want to keep in mind that women do prefer having female healthcare providers, especially when they're undressing. Yeah.
Okay. And how do they feel about getting blood or blood transfusions?
So overall, they are pretty open to procedures like that, especially when it is life-threatening. However, you do want to communicate how expensive these procedures may be, because if it is too expensive, they don't want to put that burden on their family. So more likely than not, they may say no to procedures like that, unfortunately.
And that would include the organ transplants as well?
Yes, if it is, those procedures are expensive, so
Absolutely.
they may say no. But do, as the nurse, you want to let them know how important it is and how long they'll live after that,
Sure.
that organ transplant. And especially for, it is common that patients don't get any sort of aid, like how we have Medicaid or Medicare. They view that as kind of like charity. So especially if they're, getting procedures like that, it is expensive. So it's important for us as nurses to communicate that with them.
Okay. Are there any assessments that a nurse would look out for when she's caring for them?
Well, the Poles tend to have a poor diet. A lot of their foods are high in cholesterol, sugar, and salt, so we really want to get that lab work. And we may, understand that those foods, because they're so high in those, in the cholesterol and the blood sugar and the salt, we just want to advise them about healthier food choices.
Sure. Is there a specific relationship? Is there anything different about a relationship a nurse would have with her Polish patient?
It is different, especially when it comes to a doctor versus a nurse. They do see the doctor as a lot more knowledgeable than a nurse, and for us, American nurses, we have more responsibilities, and we learn a lot more in our nursing programs versus a Polish nurse. They don't have that many responsibilities. So because of that, Poles, they don't see a nurse, for the nurse to educate the patient so much than for the actual doctor to teach them their care plan. So when it comes to talking over their care plan, they do prefer the doctor more than me. Yeah.
Sure. Thank you.
You're welcome.
Thanks for tuning in.
Bye.
I'm starting.
Welcome to TPN, the
Transcultural People Network.
Today we're talking about
Polish.
Next up, we have Melanie interviewing Dr. Anna at Bellevue Hospital.
Thank you, Emily. So, Dr.
Nothing
Anna-
works here. Been here 7 years. Nothing works here.
So sorry about this. Sorry.
Yeah, we don't need pain meds, that we can basically adjourn and strengthens who we are as a person. And so,
do it. Bellevue.
Okay.
Avoid it as much as possible. But the more educated they are, the more they practice better health and have better.
The average age. Stop. And now we'll take it out to Emily, who will be instructing us.
Oh wait, are we saying it together?
You.
Thank you, Brittany. The behaviors of Polish immigrants are oh my God, I give up.
And now we'll take it out to anthropologist Emily. She'll be informing us on the health, illness, and healing methods of the Polish people.
For now, thank you for watching TPN.
Bye.